So I'm gonna do a office tour, well, op tour for you guys, because it's been a long time and I've been meaning to do this video for a long time. So here we go. So first off, this is my op. This is number 7 right here. This is my op. I also have another op, but I don't use it because it's just not set up the way I need it to be set up. So this is the other op. As you can see, it's kind of bland. The TV don't work. What else? Yeah, it's just, it don't get what it's supposed to. But over here is my op, and I'm just gonna give you guys a detailed tour of everything inside. So let's go. So first things first, we have my desk. Let me close this. I tried to keep it as like natural as possible because I know I want you guys to see like the true essence of how everything looks. So this is really how I leave my op every day. So I have a bunch of sticky notes right here. Let me close these. I have a bunch of sticky notes right here. So these are notes that I write, reminding myself of certain things, what I need to set out, what I need to order. When you first come over here, I have some codes, some dental codes, and this is my phone. This is the Velscope we use. This is for oral cancer screening. So we use that when we want to screen patients. Up here, this is my mask insert. I've showed you guys this before. This is my mask insert. I use this every single day, clean it. It's just good because you're not sucking in mask all day. So that's that. I have my loops right here, a battery right here, and a battery that is on charge. So I got this. I'm gonna uncharge. I'm gonna plug this and see how it does without me leaving it charging during the entire time. Over here we have some codes that I can use, or some videos that will allow me to just research certain things. Keyboard. I have some dental cards, some scheduling cards, as well as my card, like a hygienist card. Over here is my easy access stuff. So this is like my alcohol to clean glasses for patients, as well as a cotton swab 2x2 gauze that allows me to clean the glasses super quickly. Up here, we'll stick with the disc for right now, are where I put my belongings, and it's a hot mess. So again, I just want it to be as natural as possible. We're gonna organize it because I am going to order some shelving to put my products over here so I can get easier access to my products instead of going to the back office. But here we go. So mini cassettes right here, and I'll show you guys. They have the basics as well as all the Gracies you can think of, plus a couple of sickle scalers in there. So I use, literally, this is what I use. I don't use these big ones. Literally, I'll have to run out of all of these before I use this. This is just so big and so clunky, and it's not gonna give me enough. I'm not gonna have enough room to put my stuff right there. So I just leave that like that. These are my irrigation syringes. I really don't use these big ones. I use smaller ones, but I ran out at the time, so I had to steal from OS, Oral Surgery, and I had to get some of this. So this is like my last minute, like if I don't have any more small irrigation things, I use these. These are huge, and you actually have to, I use these. These are what I use. This is what I ran out of. So ran out of this, use those, but I like these. So that's that. All right, and we continue. I also throw in from time to time, I'm pretty good at taking x-rays, like bite wings and x-rays, without using the RAN. So I just bag these by themselves, and I just use this, and my x-rays always turn out really good. So if you're comfortable with taking x-rays without the RAN and having to do all that extra stuff, just use it by itself, because it really, you get used to it after a while. So those are the bite wings. Patient bibs. This is my floss. I leave the floss up here, and every time I prepare my trays, I just grab everything from up here pretty much. So moving forward, sometimes I put my purse up there. That's my jacket. This is a new patient blanket that I haven't used yet. This is a Sonic Care Sonic Power toothbrush that we sell. We sell that. My keys are right here, my house keys. And then we have some mouse covers. This is some toothpaste. This is Parodontax toothpaste. Colgate cavity. I've written the date and what it is. Small pair of gloves. A Reston. Up there is toothpaste, and those are PPE jackets. So those are jackets that we wear. So that's that. In all its glory, that's my desk. Above my desk and below my desk, you have, this is like my personal side, quote unquote. Got my gloves, mask. This is the Glove and Care. This is a really good lotion that I use to keep my hands moisturized, so I highly recommend that. This is mask spray. I don't really use mask spray. I mean, stuff doesn't really bother me like that, so I don't really use this as often, but I do give it to people who don't necessarily care for smelling other people's breath. This is my little desk drawer miscellaneous stuff for myself. This is just like Q Optics. This is my loop spray. Got some chapstick. This goes over my Loops Light. This is like a glow pen that we were using for promotion of glow. Sometimes I forget where I put my toothpaste when I want to brush my teeth, so I have a couple of those already open. And some gum here. This is a snack. I get hungry. I ain't gonna lie, I get hungry, so I have to have a snack. Whiteout. These are my notes that I hand write if I have any tips or tricks to remember. Some some gum there. Let me sit down. Oh, let me put this back up before I forget. And over here, everything's pretty stocked. I have, my hands are clean by the way. I have my Profi angles, my Profi paste, my 2x2s down here. This is a great fluoride that I use. This is fluoride that will allow the patient to eat right after they eat, right after they're cleaning, right after the application of the fluoride. This allows them to eat. The only thing is they cannot drink anything hot for an hour, so it doesn't like melt off their teeth. But this is a really cool device and pen. All you got to do is twist this part right here, and then you'll push this, of course, towards the end, and it'll ooze out. It oozes out pretty quickly. It's not that viscous, so I'll be careful when using that. But this is the drawer. Super organized. Got super floss right here. And you move over here. Always have some water. Always have water. I need to finish this. Over here we have our chair barriers. I have my water. These are Pro Clean brochures. I like to put in goodie bags when a patient inquires about the the toothbrushes, the electric toothbrushes we have. So I put this in their goodie bag. Also, when they want to inquire about whitening or opalescent specific whitening, this is also what I like to put in their goodie bag for them to read. And moving forward, I'm gonna come over here before I forget. More snacks. This is dried mango and pistachios. These are a wonderful combination. So this is my miscellaneous thing. Like if I run out of like syringes, I'll just quickly grab this instead of me having to like run all the way to the back. I'll grab these. So these are the syringes we use. Disposable air water tips. More 2x2, 2x2. More Profi angles and cotton swabs. So that's what's in there in my miscellaneous box, which is pretty helpful. Also under here, hydrogen peroxide. I do not use this, so I don't even know why it's under here. And these are the covers for the sensor, X-ray sensor. And then that's the computer. Under here is where I try to keep a couple of products on hand. So again, I don't have to go to the back. Periomed rinse, which you guys have seen in my previous product video. Iodine rinse. I have a water bottle for a patient just in case they get thirsty. I need to get some more. And these two I use for patients when I'm treating them. And of course the ones in the back are the ones that they'll purchase. And these are just a couple like papers and stuff we use for paperwork. And over here, this is the drawer, the goodie bag drawer. I have some other toys in the back, but for now, this is what I have. This and like a pencil or whatever. So I get some more in the back, but I don't really see kids that often. And most of them don't even want a toy unless they're like 5 and under. So that's pretty much what I have. I have some Crayola picks for the kiddos. It's great flavor. It actually tastes pretty good. I used to use these every now and then if I had something stuck, but I have braces now, so I can't. The goodie bag. I got them pretty big because sometimes I have to put those iodine rinses in here, so I use that as a carrier for them. This is the other part of the drawer. This is the patient toothbrushes. This is by Clean. It's not zooming. Clean. This is the brand I use. I have regular toothpaste, periodontix, and whitening. I also have Sensodyne somewhere in the back, but sometimes I just you know, rotate out certain things I use because most of the time a lot of the products are kind of similar, so I just rotate them. Over here is what I sell, and I need to restock it, but I'm too tired to do that, so I'm gonna restock later. But this is the MI paste I've shown you guys in the video about the products I use. This is the MI paste, so this is all the stuff I do sell. MI paste, Oral-B Super Floss, tongue scrapers, Clean and Pro, which is for cavities, as well as Prevenant for dry mouth. So these are products that I do sell to my patients. This is a miscellaneous drawer, like extra glasses or patient bib clips I use. Over here, that's the trash, super full. Over here is my glow setup. This glow setup is for like in-house whitening as well as take-home kits. So they also have brochures just like over here that I can put in their goodie bag. Over here is 3 of these opalescent glow kits that we use for tooth whitening systems. So they also have that. This is ClearCorrect brochure. So whenever I think a patient is a great candidate for ClearCorrect, I will give them this so they can kind of ponder on whether or not they should be getting this type of treatment. Curodont is also something I explained to you guys in my previous video, but the Curodont of course helps repair their enamel. So it's drill-free dentistry. You don't have to worry about getting any type of fillings or shots and whatnot. So that's a really good product to use to prevent having to get fillings. This is my electric toothbrush that I use, my Pro Clean by Sonic. It's a really great toothbrush. I have this. I have it in black, and I love it. It's amazing. So this Perio Restore is just something that's been here for a minute. I don't even use that, I'm not gonna lie. This is my baby. This is Chomper. This is my Typodont that I had in school, and I just decided I was going to take it with me, have a little piece of history with me. But this is what I pretty much use for patient care. Like when I wanted to show them how to properly brush their teeth, I use this. So this is what I use. Alright, this is the Cavitron I use by Dentsply. Nothing fancy, especially not like the one I had in school, unfortunately. So over here is where I normally put my pre-made iodine syringes, but I ran out today. I was working. So these are the different types of Cavitron inserts. I have the very like heavy debris, lighter ones for like posterior, super long handles as well. So that's what I use for that. These are my arresting little carpules that I put in here. It's just easier access for me because sometimes I don't have time to be busting open these boxes just to get some arresting tips. So I have a couple of in here just for easier access for me. And here are all my different types of anesthesia, topical anesthetic. I have bubblegum, cherry, and grape. I have mint, but I ran out. That's the fan favorite. And I also have some Oreo cakes in here as well. So the Oreo cakes is in here. So I try to keep everything similar, kind of together. This is kind of getting a hot mess the further we go down, but stick with me. So syringes for actual like needle anesthetic. So I need to bag this, ignore it. This is more Oreo cakes applicators. I don't know why I have this, but we're gonna organize this and I'll do like an organizing video. This is the Arrestin applicator. So this is what we use to actually use the Arrestin, and more junk, the same stuff. Applicator tips for the topical anesthetic, which is there. And this is for preventive measures like doing sealants. So my sealants or Curadont I will put here. So that's all my sealants and my I can't even think right now, and my etch cotton barriers, and some more Oreo kits down here. And that's kind of junky. I'm gonna organize this as well, don't judge me. And junk drawer, and that over here. And this is the op. The rest of it, I took off the high speed and I tied it right here because I like to hook up my ultrasonic right here just for easier access. So this is how I have it set up. It's just easier for me. And then we have a small mini trash can inside there, and I have a mirror. There I go. So I have my mirror, so when I'm actually talking to my patients, I can grab the mirror, be like, hey, look at this, I want to show you this product or show you this area where this product can help you. And I also have an Pharma, aka Arrestin resource thing. So if I want to like quickly show someone something, I'll let them pull their phone out and I'll let them see like a QR code / video. Over here we have more Arrestin or Pharma information, and I like to use this for patient treatment and like actually having them to understand like what's going on, why do I have this type of cleaning. So say for instance, I'm like, they have a SRP patient who just wants a regular cleaning. I'm like, well, you don't have a regular mouth, ma'am, sir. So what I do is I'm like, hey, normal cleaning is here. This is the clinical area that we actually clean. We might clean a little bit below the gum line because it's like 1 to 3 inches worth of gum tissue that you can actually clean when they're healthy. But other than that, we're cleaning this area right here. When you have bone loss, I like to show them that. I like to show them like the bacteria that they could possibly have and the reason why their bone is gone below standard levels. I like to show them all of that, and they actually understand way better when you actually show them pictures and show them their x-rays. So here we have the oral cancer screening picture, things that we usually see with an unassisted eye, and then when we actually use the veil scope, the areas of darkness or those possible cancerous lesions we can see with the veil scope. So I have seen a couple. It's kind of scary, but I'd rather prevent this from happening. So I always recommend that for them so they can have the option. And then that's just another Arrestin poster there. I like posters. Posters get people stuff to read, and it's just